Okay, cool. All right. So what's the purpose we're doing the EGD?
Diagnosis and treatment both.
Yes, is it for the diagnosis and also treatment both, right? So the diagnosis, we want to see what's going on with all your esophagus and also your stomach and maybe also like a upper part of a duodenum. All right. But whenever we find out some kind of problem in EGD and this kind of tube, sometimes we actually can do something. For example, they can just have a faucet, they can collect the biopsy, and either way, they can have some kind of like a cyto, the kind of like a frozen therapies, so they can heal with the ulcer. Okay, so this is the EGD, the purpose, okay? Remember these two, very important. One is for the diagnosis, another one is for the treatment. All right, the second one. So I just find out, okay, the second one, H. pylori infection treatment, okay. In your message and also in your pharmacology, I both have a question. Yeah, I guess I just forgot. So that's why I put it again. But the answer is different, a little bit different. Okay, just let you know. So let's see the second one. So H. pylori infection treatment. So how can we treat with the H. pylori infection treatment?
2 antibiotics and 1 PPI.
Yes, but how many antibiotics I need to use at least?
10 to 14 days.
No, how many antibiotics?
2 or 3.
Yeah, at least two. Okay, I want to see at least two antibiotics. So some doctor maybe will use a 3 or 4 antibiotics. It depends on how severe it is. Okay, so that means what? One antibiotic is not going to be enough. It's not going to be correct. So I cannot just use one antibiotic because H. pylori, this kind of like a bacteria is very nagging, so it's so difficult to kill. Then lasts so long. So that's why you will not just one less kind of bacteria is not creating kind of like a antibiotic resistant. You have to use like at least 2 antibiotic, and also with some kind of like antacid. So PPI is the first choice we can use. But if we don't have a PPI, we can use some other things. Okay, at least one of a antacid medication. Number 3, the barren swallow procedure complication. So when the patient just do this procedure, what will happen? Complication, I mean, it's kind of like a little bit side effect, but because it's not medication, that's why we say complication.
Aspiration?
No. If they have aspiration, that's a contraindication. We cannot let them know. Huh?
Constipation?
Constipation, yes. It is
Dye allergy
constipation.
reaction.
Yeah, it is constipation. How can we prevent it?
Hydration.
Drink water.
Hydration, drink water. So usually, the barren swallow, we don't want them to stay in our colon for how many days?
72 hours.
Yeah, that means 3 days. So within like 3 days, I want to see all this barrier is kind of eliminated by your body already. Okay, that means for all these 3 days, I need to keep the patient keep drinking the water, and that's why they can poop. All right. Number 4, stool culture is testing what type of a symptom?
Bacterial infection. The
Yes.
parasite, C. diff.
Yes. So the bacteria infection, something like maybe C. diff, right? And the parasites, and also we maybe can testing for some kind of like colon cancer. Okay, so this is testing for what kind of a symptom. Can we also testing for the blood?
Yes.
Yes, we actually can do this, but usually we don't use the culture. We use of course stool sample. Okay, but yes, actually we can do it. All right, dental care. Okay, how we clean the patient's denture? This one
Clean
is not.
daily.
Yeah, this one is not very
Yeah.
difficult, very easy. They're asking you the procedure to clean the patient's denture and what you need to be careful, what you need to know.
Do you put a towel in the sink so that if the dentures fall, they don't break?
Yes, that's good. And what else?
Use a soft toothbrush?
Yes, correct. So toothbrush. Okay. Do we use a normal toothpaste?
No.
No, okay. We use this. We don't use the commercial toothpaste anymore. Okay, if we don't have like a special toothpaste for the dental care, so that's why we just not use anything. We just brush it, gently brush it. Okay, and maybe with some kind of like mouthwash. All right. So after we clean it, so we put in the dental where they do have a dental box, right? So we put it in a dental box. But inside the dental box, if overnight, I should put something in the dental box. So what should I put in the dental box?
Water.
Water, yeah, water. If you don't want the bacteria growing, so maybe like a salty water, which is kind of like a normal saline, right? Or some people will put like a dilute mouthwash. Okay, that's all good. You can use it. Okay. All right, number 6, mucositis, oral care. All right, mucositis is about what? Is a patient having the chemotherapies and then have some kind of like an ulcer in the mouth. All right, so how you do with the oral care?
Every 2 to 4 hours and no alcohol massage.
No alcohol or mouthwash, yes. Or either way, if you want to use the commercial mouthwash, you have to dilute it. Okay, you need to dilute it. So the oral care, before we doing the oral care and the patient is feeling painful, so what kind of medication we can give?
Lidocaine.
Lidocaine, yeah. Local anesthesia, okay? So lidocaine is good. All right, if we don't have lidocaine, then mucomycin is also good. All right? Okay, so number 7, the cold sore, the trigger. What is the trigger for the cold sore? What is cold sore?
Herpes.
A virus?
Herpes type 1, right? HPV type 1. So this is kind of like the virus in the patient's body. Once they get infected, maybe when they are little kids, so they will be hiding in the immune and also a nerve system. So whenever they get a trigger and they will show out, so it's kind of blister on the oral area, like a lip, and sometimes it's inside the mucosa area. All right, so the trigger could be like what? What will happen if they're just showing with this symptom? Usually, is their immune
Stress. Stress.
S?
Stress.
Oh
STRESS.
yes,
Stress.
stress, and also immune system is also low. Okay, stress is a trigger. Yes, it's true, and also immune system is also low. So whenever ever the patient immune system is going lower and they get sick, they will trigger with a cold sore very easy. Okay, and oral care, this is the oral apply. I'm not worried about this because this oral care is not very difficult. So you guys just try to pick the correct answer. Okay. Number 9, long-term GERD complication to esophageal. What happened to this one? The stomach acid reflex come over to keep irritate to the esophageal, and what will happen later?
A Barrett's esophagus.
Yes,
Cancer.
the Barrett's esophageal, which is a cancer. Okay, which is cancer. It's very easy to become like a cancer. Okay. All right. So the number 10, the GERD recommend diet. The girl recommend diet. What kind of diet they eat? What they should eat?
Small frequent meals.
Small frequent meal is
Fiber?
good. Huh? How about
Low fat.
non-spicy? Low fat, yes. Can they eat a blend diet? The answer is yes. Why not? Because the blend diet, there's no any spicy, not adding anything. So that's why the girl patient, they also can eat a blend diet. That's fine. Okay. So eat a chopped diet and a ground diet, is that good for this patient? For the GERD?
Yes.
Yes. Okay, the chop diet is also good for this patient because if the patient have some very big chunk of meat inside their stomach, that take more time to digest. So that means the stomach is gonna keep releasing the stomach acid, more acid. They won't just break down that piece of meat. So if the meat is being chopped, the food is being chopped very well. So that means that digest can be a little bit faster. That's why you're going to release a less stomach acid. Okay? All right, so you got it. Good. So 11, the better position for the GERD.
Elevate head of bed,
High
32,
power.
40,
Yeah, high
and 45
power.
degree.
Yeah, and elevated head of bed. Yeah, this is almost a correct answer. Yes, very good. All right, 12. The peptide ulcer with a pharmacological agent.
Antacid,
API.
ATT, PPI,
We can use PPI and antacid. Okay. Yeah. How about a coating agent?
yes.
Yes, that also good too. Okay. This one should be in the pharmacology. I don't know why I put it here. But anyway, so we learn everything, okay? So untreated peptic ulcer severe complication. What will happen for this one? The severe complication. So I'm not going to. I don't want to hear you tell me say, oh, it's ulcer, so it's a bleeding, like some diarrhea or nausea, vomiting, and some diarrhea stool. No, severe one. Give me the severe one. What will happen?
Perforation,
Perforation. What will happen after perforation?
peritonitis,
Yes, correct. Peritonitis. Okay, everybody hear that? All right. So number 14, Barrett's esophageal, the nursing action. So this is Barrett's esophageal is kind of like by the GERD irritation so long. So that's why it's kind of like almost become like a precancer. Okay. So what is your nursing action? What will happen to this patient usually? So they maybe have some tumor there, and the patient will complain something to you. How about difficult swallowing? Yes, right? So your nursing agent is like what? So just elevate the head of bed when the patient is eating. We don't want the patient choke. All right. So we chuck the food for the patient, or we choose like a brand food diet for the patient. Okay, non-spicy one. And we need to recommend the patient go to see the GI doctor, right? So maybe we need to do some exam like a esophageal, like a endoscopy, EGD. We will find out what's going on with this patient. Okay. All right. Number 15, esophageal cancer. The symptom. Do you have any concern?
Progressive dysphagia,
Yeah, we just said that earlier, right? In 14. So the most big concern is this is a cancer here. So that doesn't matter we treated or untreated yet. The patients always have some kind of difficult swallowing, dysphagia, and whenever every time patient eat, it's very easy to cause aspiration. So this is the two big concern: dysphagia, difficult swallowing, and also aspiration. Okay, because it's so close to the airway, that's why. Esophageal cancer diet choice. Well, again, GI have lots of diet.
Soft and high calorie.
We need a high calorie. You're right. Very correct. Yeah, because it's a cancer, right? So that's why they need a high calorie food. But is that okay to take like a high sugar food? What happened to the esophageal cancer? Can they take a high sugar food? Because we say high calorie. The answer is not.
no,
The answer is not.
no,
Why no? Why not?
because of acid.
Yes, it will trigger more acidic stomach juice. So you are cancer already. Why you want to bring down the stomach acidic juice again, right? So this is the reason. That's why we don't get like a very the citrus are very acidic food, and also spicy food, and also sweet food. Okay, so the diet we can choose like a non-spicy food like this, and chop diet and a blend diet. This is all good. All right, and easy swallow food. Okay, so number 17, esophageal gastrectomy. Incision is red and warm to touch. So your intervention, what happened to this? The incision site is red and warm to touch.
Possible infection?
Yes, this is not normal, right? Because red and warm to touch usually is kind of like a infection site already. Yeah, so that's why your intervention is you follow up with infection precaution. Okay, so that's why assess the patient infection and see if any like drainage and any kind of like the suture site is popping out and see the white blood cell. Okay, and is infection already, and then you tell the doctor, maybe we can get some antibiotic treatment. Okay, notify the doctor and checking the vital signs, see the temperature. This is all you can need, all you can do. Okay, and number 18, the post-esophageal gastrectomy education.
Yeah, half position.
Yes, yes,
The smaller high protein meals
yes,
and the aspiration prevention.
yes. After they done the surgery, they actually still will cause the aspiration very easy. Okay, even we remove the tumor, it's still aspiration precaution. Okay, be careful for that. Okay, and also the small frequent meal. Okay. Number 19. So the frequent aspiration during the feeding. So your intervention. Remember, I tell you the big hint. Okay, give me the number one. Number one intervention.
High fellers?
Yes,
High
high follower. Give me the number two. Number two intervention.
Oral care.
Yes, right. Thank you. So the patient have an aspiration doesn't mean they aspirate by the food only. They also can be aspirate by their own mucus and also saliva, right? So when we do the oral care, we can clean the saliva and also all this mucus, and also we can suction. We can provide the suction and suck it out. So that's why we decrease the aspiration. Okay, good job. Number 20. So esophageal gastrectomy, the dumping syndrome management. Okay, the dumping syndrome for this one, esophageal gastrectomy, this is a type 1 dumping syndrome. Right? Type 1 dumping syndrome is a surgery caused the dumping syndrome. So how we just manage that?
6 small meals, no fluid with meals.
Yeah, can we drink in the water together in between?
No.
No, because it's even even more easy to dumping syndrome and diarrhea, right? All right, and what else?
I think you lay down instead
Yes.
of HOB.
True. This is type 1 dumping syndrome by the surgery. That's why after the patient eat, we let the patient lie down. Okay. It's different than the type 2. Okay. The type 2 is because the G2 feeding, right? So that one you cannot lie down. Okay. This is type 1. All right. And what else? What do I need to check a vital sign?
Yes.
Why?
Because you can have hypotension.
Yes, true. Yes, true. So that's why after we feed the patient is eating about like 30 minutes later. Then the patient get ready to lie down. You tell the patient, wait a second, let me check your vital sign. So this patient is very special. We check their vital sign. Okay, after they eat. So that's why we want to prevent the blood pressure going too low. Okay, going too low. All right. So you know most of this. Okay, good. So the 2021 post esophageal gastrostomy diet education. Not diet again. Okay. So still the same. You find GI diet almost everybody almost the same, just a little bit slightly different. Still the low fat diet, and we want a high protein and high calorie, but not a high sugar. Okay, low sugar. All right, and maybe chopped food is good for their digest. Okay, and number 22. So the lifestyle modification for the hiatal hernia and the COPD. Okay, what
No
happened?
sedation?
Huh?
Stop smoking, smoking cessation.
Yes, very good. I was thinking about maybe you don't understand for these two disease come back together, but you got a point. Yes, so that's why I guess you see the COPD. That's why you can think about okay, it could be also effect to the hernia, right? Yes, the smoking sensation. Okay, they cannot smoke. Okay, and what will happen to a hiatal hernia if they smoke? All this smoking and nicotine will be trapped in their pocket, in the hernia pocket. So in that area, it's going to cause a cancer very easy. So this is the reason that's why we don't like them small. Okay. All right. 23. The gastro surgery anemia supplementation. What happens if we just take out the stomach? We have one thing in the stomach, so that one is helping something to absorb, and we're helping the blood.
B12.
B12, yeah, B12 is a nutrition. That's good. But before the B12, what kind of things in the stomach? Nothing will helping the stomach absorb the B12. That's why we're not going to cause a pernicious anemia. You see, remember? Intrinsic factor.
Oh.
Yeah, it's on the stomach lining. So if we take out the stomach, we don't have an intrinsic factor anymore, right? So this is the reason that's why B12 is not going to be absorbed by your GI. So your GI cannot absorb for the vitamin B12 anymore. So that's why we need an injection. We need injection for the patient. Okay, and then 24. Ulcerative colitis. Report bloody stool and dehydration and your intervention.
Treat dehydration.
The dehydration. Okay, what's your nursing intervention?
Treat it.
We give fluid, right? But usually,
Yeah.
how can we give the fluid? How we give it? Remember, this patient is going to be doing what? The patient is going to be bowel rest. So usually, this patient is going to be on
IV?
NPO. Remember this? So that's why the hydration usually need to be given by the IV. Okay? So then it's going to be IV hydration. All right. Then 25. IBS, inflammatory bowel disease, the severe complication. Give me the severe one. What will happen?
I think again the peritonitis.
Peritonitis, yes. There's also another one will happen.
Perforation.
Perforation and peritonitis are almost the same, right? But here's also another one. Think about it. So, for the ulcerative colitis, the patient lose lots of blood.
Oh,
Yeah, what will happen? They lose lots of blood.
Megacolon or something like that.
The hemoglobin is going to be so low, so severe anemia and also
Anemia.
hypotensive. Hypotensive.
Mm.
Yeah. And also another thing is that they keep having the diarrhea. Okay. So dehydration and also hypotensive. Yeah. So one of the severe
Hypovolemic shock?
complications is going to be hypotensive.
Is it hypovolemic shock?
Hypovolemic shock. Yes. Yes.
Mm.
Good.
Okay, thank you.
Yes. All right. 26. Crohn's disease is imbalance for what? Just like
Mm.
25, they kind of look the same. They're imbalanced for the fluid and also
Electrolytes.
electrolyte and fluid. Yes.
Nutritional imbalance.
It could be also nutrition. Yes. Yes. Imbalance, nutrition imbalance, and also the electrolyte and also the fluid. But we see the electrolyte and the fluid first because they have a lot of diarrhea. Okay, that will be the first one to impact. And then maybe a couple months later is a nutrition imbalance because they keep losing weight.
Mm.
All right. So the Crohn's disease, perineal area care, they're having lots of diarrhea. So what will happen to their perineal area?
Gentle clean.
We
Oh,
clean what?
sitz bath. Sitz bath.
we can use a cyst bag, but usually this patient doesn't really need to. 'Cause
Cream, lotion.
yes,
Cream.
the skin
Yeah.
barrier cream. Okay, it's
zinc
skin barrier.
oxide, zinc oxide.
What jingle sign?
Yeah, zinc oxide cream. Apply zinc oxide cream.
The
What's that cream?
barrier cream.
Jingle sign? What's kind of? You mean the
Oh.
corticosteroid cream?
Sorry.
Don't worry about it. Please tell me your idea, okay? No
Yeah,
problem.
my bad.
I like you have an idea, okay? All right. So we applied some skin barrier cream, right? We clean the patient for sure. Okay, we clean the patient. So the perineal area will make sure and assess with their skin, like a redness and also like a skin tear and also burn. Because this is kind of like a diarrhea. They have a lot of enzyme inside the stool. So that's why it will burn your skin. Okay, and it's also very high concentrated with the stool and the urine. So that's why assess the skin very carefully and also apply the skin barrier. Okay, and constantly to checking the patient if they have diarrhea and clean right away. Okay, 28. How could you know the clients understand the colostomy care? This is fundamental nursing. How we know they understand the care, how to. They don't
It should
know.
be pink, like the color.
Pink and beefy, yes, that's true. Okay, but here your client is gonna change everything. Okay, they're gonna change the colostomy, the new one, and they're gonna clean by themselves. Okay, but how can you know as a nurse? How can you make sure they understand? That's why I can discharge them by one of method. Okay, you asking your patient do something.
Demonstrate.
Yes,
How
actually, it's
to
a
do it.
demonstrate and a teach back. Demonstrate and
Oh.
teach back. Okay, so can you show me how you do this? Okay, can you show me one time? Okay, and how you just change with all the colostomy? Okay, and teach me. Now, just pretend I'm the patient. You're a nurse right now. Teach me and teach back. Okay, so the 29. Right lower quadrant rebound tenderness, and this is a diagnosis about what? This one is easy.
Oh, appendicitis.
Yes, right. Okay, the 30. High risk of developing of the peritonitis.
Ruptured appendicitis?
Yeah, there's a lot of things. Yeah, like the rupture and perforation. Okay, it's all some kind of like very high risk developing peritonitis. Okay, so also like your organ maybe have some kind of something wrong, like a cancer is also kind of like a become a peritonitis very easy. All right, so it's kind of like a bacteria.
Diverticulitis?
Diverticulitis, yes. Yes, if unfortunately diverticulitis is ruptured and you cause a peritonitis. Yes, this is all the risk factors. So that's whenever the bacteria go into your abdominal cavity, will become like this. Okay, 30 question. We have any question here? If not, we're gonna review the medication.
Okay.
Any
Okay.
more question? No?
No question.
Okay. Let me switch to the MedSurg study guide. Okay, this one closed. So let me see. We open this one. Okay, sure. This one. Okay, this is the pharmacology. Everybody got it, right? The same, 30 question.
Yes.
Yes.
Okay, cool. All right. So this is the medication. Okay, medication this time for most of medication is kind of straightforward, not so many trick. Okay, so it should be a little bit easy for you, but we still review it. Okay, so just remember, just catching the note I told you. Okay, I think you'll be doing good. So number one, now thing for the oral and candy that I use. This oral is infection. So how we use this medication? Okay, so I didn't tell you like a very detailed. So now I'm gonna tell you. Okay, maybe I tell you a little bit. So maybe you forgot. So this is kind of like a solution, oral solution medication. So this medication will come with like a white or yellow color. Okay, it's kind of like a liquid. So that's why you're asking your patient to just rinse the mouth, and then swallow it. That's why you don't spit it out. Okay, so the reason is that because this is medication, we want you to drink it, and also we want the body will absorb some medication. But of course, remember some class just tell me say that sounds disgusting. You're swallowing all the yeast infection. I say yeah, but you have a stomach acid, and stomach acid will kill all the yeast. So that's why we should not worry about it. So this medication, you cannot spit it out because it's expensive. So that's why when you spit it out, you still need to take it, right? So that's why you need to drink another one. Okay, so the problem is that after we rinse this medication, we drink it, so we have some kind of irritation on your oral area. Okay, so whenever a patient complains to you, oh, I have some kind of like a irritation in my mucosa. So what should we do? We ask the patient, okay, just rinse your mouth and spit it out. Okay, so we can use a warm water or like a saline water. Just rinse your mouth and spit it out. But majority of medication is swallowed first, and then we rinse later. Okay, everybody understand?
Yes.
Okay, good.
Yes.
Okay, very good. Okay, thank you. So, number two, okay, this medication, I never talk about that, but now I just put it, okay, because the ATI they use this medication. So, tacrolimus, this ointment we use it to treat the local cold sore. It's an ointment. So whenever you have a blister, we just put it on your lip. Okay, put it on your lip. So this medication can helping to heal with your blister. So that's why we're helping the blister become crust. And that's why they will, it's not popping out, will become like a contagious, so they can heal much faster. So storage in the room temperature, but in the real life, some people like to put it in the refrigerator because it's cool. It's cooler when they apply on the cold sore. They feel very soothing. Okay, apply between the meal and use a straw. Okay, what does that mean? So if you apply the medication on your lip, maybe just close to your mouth, so that's why you don't want accidentally to eat this medication. So after you eat the meal, so that's why you apply. So that's why it will stay there for a while. And if unfortunately, so you need to eat something or drink something, please use a straw. So that's why the medication is not directly and just by eating by you by accident. Okay, here's another very important thing. Okay, I just found it from the ATI. Do not apply to the nipple. So you're gonna think about, oh, who is gonna apply to the nipple? Yes, because the cold sore also will happen to the nipple, especially in one condition when a woman is doing the breastfeeding. Okay, when they're doing the breastfeeding, so unfortunately, if the baby. Unfortunately, the baby, they just got the cold sore. Yes, baby will get a cold sore. Okay, so that's why you apply the ointment on the baby's lip. And some mother is kind of feel like, oh, let me also apply to the nipple. So it kind of like prevention. No, it doesn't. And also sometimes, unfortunately, the baby's cold sore will also affect to the mom. So we're also going to the nipple area. You're gonna have a cold sore around your nipple. Okay, so this is the reason. So when the baby usually have a cold sore, so we'll recommend the mother, okay, start the breastfeeding and just maybe use the formula to feed the baby. So until for the cold sore is kind of crusted, so it's getting better, it's not contagious anymore. So maybe you can come in back to do the breastfeeding again. Okay, understand?
Yes.
Yes.
Okay, cool. So this is something we are missing, okay? The ointment. All right. Number 3, calcium carbonate, the side effect, the normal side effect. This is easy.
Constipation.
Yes, because the calcium, right, is a C, is a cow, calcium, constipation. Constipation. All right. Number 4, solder, the mechanism. This is sodium bicarbonate. How can they help for the heartburn?
Neutralize HCI.
Well, they actually balance out the pH level, right? So that's why they are more alkaline. So that's why your stomach acid is acidic. So that's why when we just drinking this water, it's forming a tablet. So we put in the water and then we drink the water. Actually, it's more alkaline water. So it actually can balance out your stomach acid. So this is their mechanism. Yeah, balance with the most likely is the pH level or balance with your stomach acid level. All right. Number 5, famotidine, the serious side effect management. Okay, here serious side effect.
GI bleeding.
No,
Confusion.
confusing, right? Yeah.
Yeah. Disorientation.
PNS.
Yeah, disorientation and confused.
Hallucinations.
Hallucination, maybe, yes. So this is a medication will affect to your nausea center, okay,
Yes.
in your brain. So it will also affect to your brain. So this is the reason that's why this medication will cause a confuse if it's a severe side effect. So unfortunately, if we use this too long term, okay, the patient is getting more confused. So this is the reason that's why in the nursing home, if I need to use this kind of like a famotidine, like a Pepsi or like a Zentac, and if like over 2 weeks, I'm not going to use it to the grandpa or grandma because they maybe have like dementia already. It's going to get more worse, more confused. Okay, so the severe side effect is confused. Okay, disorientation. All right. Number 6, antacid administration time. How we give the
People-
antacid?
Yeah, people 30 to 60 minutes before meals.
Yes. Can we give between the meal?
Yes.
Yes. The answer is yes. So as long as the antacid I don't give with the food and the medication together, that will be fine. Okay, we space out. Don't give it together. Okay. So before the meal, that's okay. After the meal, that's okay. No problem. Okay. After you digest, we just give. All right. All right. The next one, the teething medication and the mechanism. Like famotidine, right? The Pepsi.
Block the highest type H2 receptor.
Yes, true. Blood H2 receptor. Okay. It's blocking the H2 receptor. Okay, number 8. The primary reason for the spacing the antacid with other medication by 1 to 2 hours for what? Why we need just to separate them? It's easy, but I'm
So
guessing
it
you don't.
doesn't.
No absorption. I mean, you
Well,
cannot
so
absorb. Oh,
because we don't want them blocking the medication absorption. Yes, yes, yeah. So that's why we want a medication have a better absorb, but we also want control with the ulcer, right? So that's why we use this medication. But then, when other medication need to be absorbed in a good timing and a good effect, that's why we're spacing out. All right. So cytotec, this medication, common side effect.
Diarrhea.
Huh?
Diarrhea.
Yes, diarrhea. Okay. All right. So this is a normal common side effect. How about number 10? Contraindication for using this medication. Who
Pregnancy.
cannot use this medication?
Pregnant women.
Yes. Thank you so much. Thank you so much. If they're pregnant, that using the medication is going to cause a miscarriage because all the stomach muscle is going to be contract, including their uterus. Okay, good job. So the next one is 11. Taking a protonist long-term potential complication. If I taking this medication too long, what will happen?
Osteoporosis?
Hypomagnesemia.
Excuse me?
Yeah, hypomagnesemia.
Yes. It's not just only magnesium. It's for two electrolyte, magnesium and what?
Potassium.
No.
Sodium.
No?
B12.
Calcium.
Calcium. Yeah. So it's a magnesium and calcium. Okay. So that means what? So if the calcium is not being absorbed, so the long-term potential complication is
Fractures and osteoporosis?
Bones.
yes, fracture and osteoporosis. Yeah, we need to be careful for the fracture. Okay, because of lack of calcium. All right, 12. So protonist. So the patient is reported feeling extremely tired and dizzy. What's the reason? What will happen if
Hypomagnesemia.
Low magnesium.
Yeah,
lack of
hypomagnesemia.
one thing is that
Lack of-
because go ahead.
Lack of B12?
Aha! You both you I heard both answer. I'm so proud of you guys. So good. You can take a test right now. Here, the number one reason is because of electrolyte imbalance. Of course, you feel like a tired and dizziness, right? So electrolyte, we don't have a magnesium and we don't have a calcium, right? So that's normal. And the second thing is that remember I told you very important thing is that antacid is going to cause some kind of malnutrition. That means what? So some kind of iron or B12 is not going to be absorbed very well. It's blocking them. So this patient will have lack of the vitamin B12 if they use the protonist so long. So it's going to be caused anemia. Okay, so number 12, please go to see the answer. If the answer have like electrolyte imbalance or either way have anemia. Okay, but for sure this one, so extremely tired and dizzy is more like anemia. Okay, why? Because it's a dizziness. Okay, tired and dizziness both. So if it's only like electrolyte imbalance, usually it's only happen one, just feel tired or just feel a little bit dizzy. Okay, that's very good job. All right, 13. Therapeutic action for the carafate.
Coating.
Yes. So the carafate will be coating the ulcer. Okay, so be coating and helping the ulcer get the ulcer to heal. Yeah. So number 14. How to take an antacid with a carafate. So the doctor prescribed a carafate, but the doctor doesn't think, oh, that's not enough. I need another antacid. Okay, can we take two antacid together?
No.
Separate.
Huh?
Like
An hour apart?
like
Good.
that.
First, we don't take two antacid together because it doesn't work that way. Okay, the both antacid was both blocking each other. They'll be kind of blocking each other. We just need one antacid in one time. So in the between, for the next doses, in the between, we can use another antacid. Okay, another antacid. So that means what? I need to space out the both antacid. So like at least like a 1 hour, 2 hour. All right, good job. Okay, so number 15, carafate administration knowledge. How we give this medication, carafate? Just very easy and simple.
Empty stomach.
Yes. How for in what kind of condition? Empty stomach. How long?
1 hour before the meal.
Yes, 1 hour before the meal, empty stomach. Thank you so much. All right.
Mm.
Okay, number 16. and testing and administrative knowledge. So this is select all apply. Okay, I'm not worried about this. So just pick the choice and you know. Okay, yeah, most of the answer we have it already, so you know it. All right. 17. Long term to use the regular. What will happen if long term use it?
How do you die condition?
Say,
PD.
say that again. TD?
PD.
Yes.
Yeah.
Yes. Thank you so much. TD. Okay. EPS effect. And also like a seizure. Okay. So long term use of regular action is not helping because the regular is what kind of a category medication? Like a regular is kind of pro-kinase medication, right? Like a
Parkinson's med?
Yes. So that's why it will affect to your brain. Okay, affect to your brain, your central nervous system. So that's what will cause the muscle involuntary movement. So it's become like a TD. Like a patient that taking the side medication will have a TD, how EPS effect. Okay, good. So 18, the regular drug interaction. So this medication cannot be used with what kind of medication together? You still remember?
Parkinson dopamine.
Parkinson medication.
Yeah,
Yes,
medication.
Parkinson's the medication. Okay.
Levodopa.
Yeah, they're not working together because they will cancel each other. Okay, they will cancel each other. All right, good. 19. Chemotherapy for the esophageal cancer. So the reason delay the surgery. Okay. So why the chemo this patient is delayed the surgery? I don't remember this one, the answer. So the reason we delay the surgery, so it must be something is not kind of like a safe, right? Oh, I know. Okay, I know. Yeah. So when the patient uses the chemotherapies and then they have for the cancer, so the patient also need to go to the surgery. But unfortunately, we need to delay the surgery because the chemotherapy will happen what? What happened to the blood? Blood, yeah. When we do the chemo, something will happen to the blood.
The blood gets taken out and then put through a machine to get clean and then put back in the body.
That's a dialysis. That's dialysis. So chemotherapy will cause the whole blood decreasing. So white blood cell, platelet, and also your red blood cell is going down. You remember this? So that means the red blood cell is down already, and also platelet is going down. How about if we go into the surgery? What will happen? Bleeding, right? It's going to be cause lots of bleeding. Okay, how about the white blood cell? White blood cell decreasing is going to cause very easy to infect it. It's going to get an infection very easy. Okay, so this is the reason why we delay the surgery. We want the patient, okay, after the chemo to become more stable. That's why we can give a surgery. So that's why we don't do the surgery after the chemotherapy right away. All right? 20. Okay. Severe nausea. So it's a better route when we give the Zofan administration. So because the patient is nausea, they are vomiting. So can we give an oral pill?
IV.
IV, yeah. So remember in the PowerPoint I told you the Zofan they have an IV and pill form, right? Available, right? Okay, I forgot to tell you. Zofan also we have a sublingual form. We also have a sublingual. Yeah, under your tongues. Okay, that's why you don't need to swallow. All right? Remember sublingual, okay? All right?
It's gonna be on the test.
What do you think?
Oh,
Oh,
so
this
answer
is-
sublingual.
Wow, answer here.
If I forgot to tell you something and I found it in the ATI, so I will tell you why this is so important.
Thank you.
Okay. All right. So okay. So 21. So why What's severe side effect for this Zofran? And we need to start the medication right away. It's why, it's not what. Okay, number 21. From the beginning, is why. It's not what. I type it wrong. Typo. So why if we just take in the Zofran and happen like a severe side effect and we need to stop it right away. So what happened to this medication? What will happen? Zofran is what kind of medication?
Serotonin, something to do with serotonin.
Yes, you're right,
Yeah.
you're right. You're on the right track. Serotonin antagonist. Yes, correct. So why we need to stop it? Because it happened something. Serotonin what?
syndrome.
Yes,
serotonin
serotonin syndrome. Yes, serotonin
Oh.
syndrome is life-threatening. Remember the three high? Hypotensive, high fever, and also tachycardia.
Tachycardia.
Yeah. So your vital sign is going crazy. Patient is dying right now. So that's why you have to start the medication right away. Okay, so that's why sometimes we cannot start the medication needed by the doctor's order, right? But this is life-threatening already. Patient will die. So start the medication right away and tell the doctor, okay, hey, I stop this medication because his vital sign is crazy right now. Okay, number 22. Okay, so lorazepam, Ativan, the possible risk factor. We give this medication to treat nausea, severe nausea. So what kind of risk factor?
Respiratory depression.
CNS depression?
Yes, that's all correct. Respiratory or like a heart rate and hypotensive, right? But here, this question didn't tell you something. Okay, for how long? If we use the medication for a while, so what will happen? If we just stop it,
Risk?
if we just stop it right away, this is benzodiazepam.
Oh.
Can we stop it right away?
No.
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 You have to
Yeah,
take off.
we need to tap off. Yeah, we need to tap it off. Okay, so benzo, you cannot start and just stop it. Okay, so we'll cause like a withdrawal syndrome. Okay, be careful. All right, 23. The peptobasmol is not given the child. What's the reason?
Ray syndrome?
Yes, we talked about that on Thursday already, right?
Yes.
Yesterday, so you still remember. Good. The rare syndrome. Because they're aspirin-like medication. Okay, they're aspirin-like medication. All right, so the normal side effect of the peptobasmol.
Tarry stool.
Tarry stool, not tarry stool, is a dark stool. The dark color stool. And the dark color of a tongue. Okay, so the peptobasmol is it will cause a diarrhea or constipation. Which one? So peptobasmol will cause
Diarrhea?
Diarrhea.
is a peptobasmol it will cause a diarrhea?
Constipation.
Yes, because
Constipation.
we use it to treat the diarrhea, so that's why it will cause a constipation if we give it too much dosage, right? Remember this medication, the pink medication, we can treat the diarrhea. Yeah, that will cause a constipation. Okay, we're good?
Yes.
Disconnect the Wi-Fi network. You might want to check the connection settings in Google Home app.
What? Okay.
It's my Google
Okay.
Home.
Okay, 25. Okay, edge priority treatment. So this is exactly the same question we in the message, okay? Antibiotic and also PPI, right? Okay,
Yes,
remember,
same thing.
I want to see the two antibiotic. Okay, there's two antibiotic. All right. Okay, number 26. What is the prophylactic treatment for the peritonitis? Why we need to give an antibiotic? Oh, actually, I tell you the answer. Yeah, prophylactic treatment is antibiotic. Shit. Okay,
Infection.
what is the prophylactic treatment for the peritonitis? We give antibiotic. Okay, so because we know the patient maybe have like a possible infection, so that's why let's give antibiotic first. I don't want the bacteria going to your stomach area, so let's give antibiotic first. So either way, if unfortunately you get infected, you'll be have some kind of controlling. Okay, so that's why we say the prophylactic treatment. All right, 27. So suppository given position. This one is easy.
Yeah,
kind of-
left.
Left lateral.
Left.
Left lateral.
Left side lying, right? Yes. Okay. 28. How long for the free enema retain the solution? How long they should wait for it?
15 minutes.
5 to
5 minutes.
5.
5.
5 minutes
Or
maybe a little bit
15.
too short. I would say like at least 10 minutes. But usually we
10
like
minutes?
like a 15 minutes. If a patient can do like 20 minutes, even better. But usually we like 15 minutes. Okay. Yeah. So of course if your patient is like very, very old or the patient just very, very weak, so they cannot hold it too long. 10 minutes, okay, sure. All right. 29. So the taking like a Imodin reported abdominal pain and fever. What happened to this? Think about something, okay? So if a patient has certain of some kind of disease, they cannot take Imodin. We don't want them to take Imodin.
C. diff.
C. diff, well, we should say
Infection?
yes.
Infection. C.
The
diff.
colon infection, like a bacterial infection, like a C. diff, right? Or like a parasite, right? So that's why we want the patient just flush out with all the colon. So that's why patient will tell you, I have a diarrhea. That's okay. Let's flush out with everything because I think you have bacteria there. Or I think you have like a parasite there. Okay, I want you to have some more diarrhea. Just flush out everything. So that's why I cannot give you Imodin before the diagnosis. Okay, so that's why the patient tell you have abdominal pain and fever. Usually is about what? Because you let the patient take an Imodin and the patient having like a current colon infection, and you didn't know, or either way the patient didn't know. They take it. Okay, they report it. So what should you do? I remember before I have a student tell me, "Oh, I give an enema, just flush out again." No, don't do that. No.
Antibiotics?
No, just let the doctor know first, okay? Because before the culture, we don't know what kind of antibiotic we can give, right? So let the doctor knows, okay? You can maybe just check a vital sign first and see the patient, assess the patient's level, how much pain and what kind of pain, how long, and the fever, how high is the fever, and then the doctor know. Okay, so when we're taking the Imodin and report this, and then we need to stop the Imodin medication and then the provider knows, okay? All right, 30, the last one. So how long will the mirrorless work? When we take the mirrors, usually will taking so how many days will work?
3 days.
Yeah, usually it's 3 days, right? So 3 days, 4 days, or 2 days is about like usually normal time, okay? Because it's a fiber powder. It's a fiber powder. So that's why it takes time. It doesn't work right away. This is not laxative. So that's why when the patient tell you, okay, I have a mirror, so I won't have a bowel movement later. No, this is not laxative. So it's a bowel management product. It's a fiber, okay? So it takes time. Okay, any question?
No.
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 Okay, good.
Maybe
So-
later.
No.
Okay. Let me know anytime, okay? Let me know
Yeah.
anytime. All right, so I'm gonna stop here. Let me stop sharing first. Okay, cool. All right. So if you do have some more question and just test me, okay? Send me a text message because I will be working for the 3 days, so I may not open my email very well. All right.
Thank you.
Okay.
You're welcome.
Thank you so much.
Thank
Thank
you.
you. Thank you.
Okay.
Thank you.
Are you gonna take roll call?
Yeah.
Well, yeah. Wait. Let me go get a pen and paper. Wait.
Rose. Hi.
Sorry,
안녕.
you're hyper again.
No, I'm not.
Anybody left already?
I don't know.
Where's Bryce? Left already.
I'm
Bryce
sorry.
left already.
Oh,
I'm
okay,
sorry?
okay.
Oh,
You're back?
Yeah, I'm here.
Okay.
Yeah.
Yeah, first thing, okay. Is a Yuan Yuan,
Hi.
okay.
Yes.
And then Sue, okay. And Rosary,
Present.
thank you. Melena and Susie.
Yes.
And this is
Hi.
hi, is Oscar. And the next one, Omegi. And this is Alice. This is Ray, okay. And this Bryce and Lorena, okay. And April.
I'm here.
Okay, cool. I heard you, April. And this is Bristle.
Here, thank you.
Thank you. And Aurora.
Here.
And Kiana. Vanessa. And Juliana Garcia, okay. And Sylvia.
I'm here. Thank you. Good night.
Thank you. Good night. And let me see. All right. I think I called everybody already. So you can go. Have a good
Yeah,
night.
thank
and,
you.
yeah, have
Thank
fun with your training.
you.
Oh,
Bye.
wait.
night.
Actually,
Tomorrow, Saturday, you have your skill lab. You remember that, right?
yes.
Yes.
Don't
Yes,
go to the
everybody
clinical
knows.
side, okay? It's not a clinical. Tomorrow is a skill lab. The Dr. Chen want me to remind you guys. Okay, so you have a skill lab in a school, okay? So come to the skill lab tomorrow in the school. Okay, please just remind each
Okay.
other, okay?
Okay, thank you.
Yeah, I'm afraid
All
about maybe you
right.
went to the clinical side tomorrow and you see nobody there.
Okay.
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 Thank you.
Okay,
Thank you.
okay,
Thank
have
you.
fun. Okay, bye, good night.
Have a good night. Bye. Good night.
Bye.